Well, this afternoon session had several issues that were, brought up. The first, of course, is the challenges that are faced by the Innovation Center in rolling out their $10 billion over 10 years to actually improve quality and lower costs. And how are they going to do that? What kind of ideas do people have that are attending the conference to give them, to share with them in order to move this agenda forward? And we heard several. I mean, it's some things are easy to do. There's predictive modeling that can be done. There's remodeling of primary care that can be done. We can do all kinds of experiments with medical homes and all kinds of coordinated care innovations and new reimbursement strategies. There's a lot of ideas coming forward, and of course the challenge for the Innovation Center is their resources to carry all this out and get it done. Well, if we really want to make healthcare more affordable and higher quality for the general public, what we really need to do is to focus on coordinating care for patients with complex medical conditions, and to focus on that in a way like we've never focused before, bringing together teams of providers focused around incentives that improve the quality and lower the cost across that team, so that you're not dealing with episodic care. You're not just dealing with one disease condition as the patient presents, but you're really looking at the whole patient. So the medical home is a good start for moving in that direction. The advanced medical home, where you have a little bit higher technology, a little bit higher interface with the patients. And then, of course, finally getting to accountable care organizations, which is really the highest level I think you can get in taking care of patients. I think if we're going to really advance high quality care, the most important thing we could do is move from the cottage industry of fragmented providers into an industry with organized systems of care where computer systems talk to one another, care can be coordinated across teams of providers, outcomes can be measured, action can be taken upon data which shows what kind of actions and what kind of costs we're getting across a patient population. Those are things we need to do, but it has to start by bringing the fragmented physicians into organized systems of care, because that's where you're going to have the greatest capability to invest in the capital for the infrastructure and the quality improvements we need to see across this country. It's all about care coordination, and you can't do that if you're out there as a solo practitioner. The thing about the Mayo Symposium that's so great is it brings people from different stakeholder positions together. Most of the consortium's meetings that I go to are single focused. They're just provider based, or they're just insurance based, or they're just employer based. The nice thing about the Mayo Symposium is you bring everybody together. And so when you're voting on what are the highest priorities that we ought to take as a country to improve quality and lower costs, you're getting input from all the different sectors, and most importantly, you're getting the patient perspective. This consortium really pays attention to patients and what patients' needs are, and that's what makes it really different, and I think that's what makes it so good.